I'm Lauren Kingston Radloff. I'm a medical officer at Red Cross Children's Hospital. I've been working in the outpatient department for 16 years, and that work scope entails looking after patients in the medical outpatient department as well as in acute care, where we see new patients coming in who are sick. So the advent of coronavirus this year in 2020 has been an exciting time. It's been an anxiety-provoking time. As an academic, it's exciting because there's new information every day. There's things to update yourself on every day. There's new protocols, new management guidelines to continuously have to review and update. And it entails a lot of changes in mindset on how patients are managed, from entering the hospital, the triage to the patient flow, having to look out for patient safety and emptying the hospital, so cancelling most of our booked appointments, having to do telephonic folder reviews instead, making sure that patients can obtain their medication safely without having too much exposure to health facilities, which are obviously going to be a risk for them. So really looking after, it's a different mindset of having to consult with regards to dress code and personal protective equipment. I had to buy myself a couple of pair of new scrubs, had to educate ourselves on safe donning, putting on the PPE, and doffing, taking off the PPE, and having to practice through that, because that in itself can be quite anxiety provoking. But the more you do it, the less mistakes you make, and it really helps having a team behind you that is encouraging, and you learn from your mistakes. Getting used to the discomfort, the really minor discomforts of having the PPE on, and even sharing with colleagues your little tricks of how to stop your glasses from misting up through the mask, and how to try to breathe easily with the visor on. It's quite an adjustment, having to try and appear friendly to little kids. When you have glasses on, a mask on, a visor on, they can barely hear you. You've got an apron on, and that's not even in your full aerosolizing PPE, just your general PPE. It is quite a scary presentation. So the patient, you have to really be expressive with just your eyes to try and look friendly with just your eyes. So that's a whole change of mindset of protection. On a personal level, I think my lowest point was probably the night before lockdown, when only essential services were going to be on the roads and allowed to travel. It was eerie, and I think the enormity of it finally hit then, before lockdown. And my biggest fear was for my family, because I would be the source of bringing the virus home. Everyone is behaving themselves with already social distancing. So it was me and my job, my vocation, which I absolutely love and I'm passionate about, but it's never really affected my family as imposing a danger to them. So having to realize that I'm the danger of the family now, and just wanting to protect them and not bring the virus home. So through this process of working through things, I've worked out a protocol of decontamination when I leave my workplace, and even when I get home, before I even greet the family, putting in plans for self-quarantine if I do get it, and how I would keep them safe by being at home. And so getting into those new habits at work and at home using the knowledge that we have of how to keep safe, and just becoming mindful of what you are doing, slowing down so that you becoming more aware of what you're doing, and just creating new habits. So it just becomes the new normal. It just becomes easier to do because you are mindful of it, but it's not so much you doing it out of paranoia, but you are doing it out of knowledge. And I think that shift from moving from anxiety to knowledge, and then once you've reached that where you're in that peaceful state, you can actually reach out. So I must say this has been a very spiritual time for me, because you are faced with your mortality, the mortality of people around you. You reevaluate what is of value to you, and slowing down makes you more aware of the anxieties of the people around you. So people tend to get very angry very easily and very anxious very easily, and they lash out, but the underlying emotion is actually fear. And being able to detect that and be able to be consciously gentle towards people when they retaliate like that, and giving them time to debrief and just let off steam and encourage them, has been a very enlightening experience. So with all things difficult, to arm yourself with knowledge, create new habits and mindsets, and see it as an opportunity to grow personally and professionally. It is an exciting time. We need to be careful and just remember to be gentle with each other, and remember to be compassionate to everyone.